You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. If you are wearing a loose-fitting denture, you have to hear what my first guest has to say. He says no more dentures, and that's the future of dentistry. And with us, we have Dr. Homer. Dr. Homer, welcome to the program.
Happy to be here, Andy.
All right.
Thanks for having me.
Now, before we get into today's topic, tell me a little bit about your center. I mean, you guys are, and I've been told, probably the busiest dental center in America. Is that right?
That's correct. It's basically a group setting where we have a focus on patient care that's very unique, to the point that we're essentially able to offer a level of convenience, a level of comfort, and a level of comprehensive care.
Those are your three pillars.
Those are the pillars.
You said, Randy, I got three pillars.
I got three pillars, and Randy, and it's great. I mean, what it really boils down to is, on the convenience side, toothache, tooth problems, toothaches, they happen at inconvenient times.
Yeah.
Your tire gets flat, you want to take care of it right now. And what our office is really catering to is when that stuff happens, when you have a tooth problem, you're in pain, you're worried, you're fearful about it, where can I go? And we can take care of it.
Don't you guys guarantee, you guys have a guarantee same-day appointment?
We do. It's a call us in the morning and we'll get you in that day guaranteed.
You have a lot of experience. You've been in your head a dentist since grade school. That's what you told me on the phone. Really? You knew in junior high that you wanted to be a dentist?
I was fortunate, Randy, and my story kind of goes along the lines of I had a smile that I wasn't satisfied with. I actually had a jaw, not a class 3. That doesn't mean much to most people, but it's essentially my lower jaw. It was that Jay Leno jaw, that prominent lower teeth.
Like an underbite.
Underbite. I smiled just to show the teeth that I wanted to. My orthodontist was involved in correcting my smile, and that was a big deal for me. And the psychology of the smile, it's a really powerful message, and that really is what drove me into dentistry, is an opportunity to change someone's life through their smile.
Interesting.
And there's a huge connection, that for me as well as so many out there, and that's the confidence that comes with it. Confidence is connected to relationships, it's connected to jobs, it's connected to our success in life, really.
Do you see turnarounds? You fix their teeth and they act differently, look differently, dress differently?
Absolutely.
'Cause I always think you guys are exaggerating
incredible
when you tell me those stories.
No, I'll tell you, and obviously our focus today is on implants, but there is, the type of, one of my pillars that I talked about is the comprehensive nature of our practice, that we see all of the procedures that you're going to find oftentimes in specialty offices in one facility. And by the way, we get the geographic boundaries for our office. We're in Billings, Montana.
People travel.
We get people from Wyoming.
Wow.
We get people from the Dakotas, all over, 5 hours away to come to our office because convenience, the comprehensive care, and the third pillar I didn't really get to yet, and that's the comfort. And that's that we have whatever it takes to take the edge off, whether that's earphones, pillows, blankets,
and dental
TV.
Implants don't hurt, by the way?
Dental implants.
That's not something to complain about?
Common misconception, not a concern. It's maybe an Advil the next day.
Is that right?
In fact, I had a case that he was a referee, came in, he was in partial dentures for a long time, really just not happy with his smile, not happy with the food that gets trapped underneath, not happy with some of the wear on the outside of the teeth from the metal clasps, those gray clasps that hang on to it.
Okay.
He was in a unique circumstance where he was able to now get some dentistry that he really needed. And obviously when we take things like costs and set them out of the way, we're going to do what's best.
Okay.
And best is implants. That's getting us as close to what nature.
It's like getting your teeth back.
As close as it gets. It's you floss them the same way, you brush them the same way.
So this referee, what happened?
Called him the next day. He had nine dental implants placed in every quad.
Instead of dentures, he could have had dentures.
Okay. He could have. It really would have been a shame to go that direction. He had the teeth that he had were in good shape, so it was just a matter of filling in the blanks.
Okay.
And so 9 implants later, next day, how we doing today? You know what? Nothing. It's a little discomfort. I'm not even taking the pain meds. I'm taking some ibuprofen, but a little sore around the gum tissue. That's it.
Okay, good.
You have to remember, Randy, there are no nerve endings in bone, and when we're able to
Good point. Okay.
when we're able to,
So that doesn't hurt. That's why it doesn't hurt.
it doesn't hurt. We make little tissue incisions that keep it to a minimally invasive process.
What's changed? And let's go right into dental implants. If they're just tuning in, we're talking about no more dentures, get a fixed set of teeth, just a few appointments. In fact, same-day appointments at your office. But why is it what used to take you guys, dental implants, according to the research I've done, it used to take 9 months or a year, and now can happen in a visit or two? What's changed?
There's a lot that's changed. Part of that is going to be a technology component. What I mean by that is we have imaging that lets us see a three-dimensional picture of the bone. That lets us pre-plan a surgery. We get to know how much bone there is versus finding out on the day of surgery, oh wow, there's
by opening it up.
By opening things up,
okay.
Not as much as I thought. That's a big
So there was
factor.
more cutting in the old days.
There was.
Stitches,
even
like
just the type of material implant that they used, they didn't integrate as well. They had to wait longer because it was an unpredictable component. Okay. And with today's surfaces basically that are on implants, the technology that's there, it really allows us to get a quick heal very predictably. We're talking about in the 95 to 98% range as far as success goes.
But if implants are as good as you say there's got to be tens of thousands or thousands of people in your area that have either an upper or lower denture. If dental implants are so good, why isn't everybody doing it? Why aren't these denture literally lined up to try this?
Randy, it's as simple as this. They just don't know about it. Let me walk you through the process of getting a denture. You're talking about people who, through maybe even an excruciating process of losing teeth, dealing with periodontal disease, pain, just that fear, they've lost all of their teeth. They look at it like, I'm done. There's nowhere else I can go with this.
Okay, good point.
I'm in a denture, and this is what it is.
They don't go to the dentist anymore, obviously.
They look at, there's no cavities. What are they going to check? We still need to see them. There are tissue changes we want to evaluate, but usually we don't see them until the denture breaks, tooth breaks out of it, or they get so worn that they just are really ready for that cosmetic change.
So you're saying these dentures, the reason why everybody doesn't do it is because they don't know their options. Mm-hmm. Because, very interesting. Now what about something like my mother, and I've said this to other people, that at 75, she told me, Randy, my medical doctor told me I'm too old for dental implants. But you say that people are getting them much older than that.
They are, and very
so you're still a candidate at what age?
Very predictably so. We have patients into their high 80s easily, even into their early 90s.
Why would a 9-year-old want to get dental implants?
It's as simple as they want to eat, they want to chew. They want to be, they're still in the social scene. They're still getting out there, eating luncheons or dinners with their friends. And I'll tell you, there's nothing like being invited over to a dinner event and not being sure if you're going to be able to tolerate what they're serving. Small social circles. I had one gal come into our office. She made the trip from Wyoming, actually. And she confided in me over tears that she was so dissatisfied with her smile, that she was in so much pain from this little appliance that she was, little partial appliance that she was wearing. She, by self-definition, said that she was crabby, that it was reflected in the way that she interacted and talked to people. And one of the big, as I followed up with her, is actually just this last week, we got her completely locked in, talked about some of those changes that she was able to experience, and she says, you know what, I think I'm just generally a nicer person. Because when you have some sore spots, when you're in pain and someone comes in and they say something to you, you're just
edgy.
Yeah, you're on the edge, and you say something that obviously you don't mean to come across that way. And that's the message for a lot of people who aren't satisfied with their teeth.
Now you brought some photos.
I did.
We have time for these photos. And this first one, because we were in the green room and I said, how important is this smile to you? And you go, let me show you this. And this is probably, by the way, if you're just tuning in, we're talking about no more dentures. Get a fixed set of teeth in just a few appointments. And we're here with Dr. Homer. And this woman. So tell me about this woman.
Randy, this I think is this is a message that's summarized in, or that you're going to find most people somewhere in this category.
Okay.
And that's that, when we talk about a very attractive woman, a very, beautiful inside and out, who is in dentures, in fact, since she was 19 years old. And to me...
Let's take a look at that. Let me okay.
Take a peek here. So
that's a young woman. I mean, this
is a young woman. She's about 45 years old,
okay.
And been in dentures since she was 19 years old, which is a tragedy. It's a tragedy for someone to get into dentures when they're 70 years old. But when it happens, it's sure nice to know that we live in a day and age where we can get you back as close as possible to teeth that are locked into place. Randy, I want you to take a closer look at this before photo. Okay. Pay attention to some of the, just the physical changes that happens, when you lose teeth. Look at how close the nose and the chin are together. Look at the facial collapse under the cheekbones. How the face kind of sinks in.
You say when they're wearing dentures for a long period of time, they lose bone.
Absolutely.
And so that's what makes their nose
closer to their face.
She looks much older than her age.
Yeah, Randy, wait till you see the after photo. It's incredible. We're talking about someone who has the appearance of being aged, going to, basically
nice.
A soap opera star here. I mean, she really has that
she looks
smile.
Like she could be an actor. Very nice.
Look at the fullness of the smile. Look at the lip definition. Look at just the fill of the cheek.
So what did you do for her, by the way? So tell me what you did for her.
This was a case where we have 4 implants in place to anchor the lower denture, and we have a cosmetic denture in the top. And that cosmetic denture,
Huge difference.
Big difference. And let me finish the story here, Randy, and that's that this picture, her hair wasn't this color before. All of a sudden,
she's kind of hip and young now,
with
right?
her new smile, it gave her a new lease on life. It turned back the clock. It said, you know what? I have a great smile. As she started getting those compliments from her coworkers, from the people around her, it was a huge boost in self-perception. This woman is already outgoing and confident, but she had kind of, as she describes it, let herself go. And with a new smile, it basically gave her permission in her mind to say, you know what, I'm going to turn back the clock. I'm going to get my hair done. She bought a couple new outfits.
Right? You say this is typical.
Very typical. This is a, I don't like who I am. And, and by the way, Randy, as we talk, you'll notice we're looking at eyes, we're looking at the teeth.
Yeah.
That's a huge part of the communication pathway. And when people aren't comfortable with their teeth, they conceal it. They look like they're mad, they're angry. In her case, she describes being at work and coming across as someone that was just irritated, that, just stay out of my way. To the after effect, where she's getting she's smiling. She's walking around wanting to show off.
Well, she's 10 years younger in the after, by the way. Something very important, because I always think you guys are exaggerating when I say, how important is a smile? It's just teeth. I mean, I've been lucky enough to have pretty straight teeth, but when you put these side by side, it's clear, I think, how important the smile is. And I'm trying not to endorse you here, by the way. I mean, I'm just asking the questions. People need to know if they're just tuning in. It's a real interview. We're talking about no more dentures, get a fixed set of teeth in just a few appointments, or snap in, snap out. Okay, so this woman is ideal. You brought them models to show me the denture wear options. What are they? So let's start with the beginning. Okay, so denture wear watching this, upper lower denture, they come in. And do you show them these models?
Absolutely. This is we let them hold them, we let them snap them into place, get a feel for the retention.
So what is this?
Comes.
What is this right here?
This is 2 traditional implants in the lower arch. This is one of the most common procedures that we do. Life changer. I mean, you're talking about every time your tongue moves, your denture moves, going into all of a sudden locked into place. Go ahead and feel that, Randy.
They like this? Okay, is this accurate? Okay.
See if you can get those.
I'm trying not to exaggerate here, by the way. Okay.
Oh,
sometimes you have to lose. I mean, if somebody has arthritis, how do they get this out of their mouth?
There are varying degrees of retention clips.
So you can make it tighter.
We can adjust that.
Okay, so this just goes just like this.
Snaps right into place. I mean, doesn't that just sound good?
2 implants.
2 implants.
Do you think people also self-diagnose and they think, oh my goodness, they count their teeth and think it's too expensive, but just 2 implants will change everything?
2 implants.
So no adhesive on that?
That's the great thing.
They won't need adhesive?
That's the great thing with implants is we literally are able to get rid of the adhesive component, and that's oftentimes a bad flavor. A lot of it gets swallowed, which is toxic. It's not a good thing that we're ingesting that. And then a dissatisfaction level with wearing something like that all the time. There is a huge boost in every aspect of chewing.
You were trying to pull it off and you couldn't right
there. It was just, I mean, literally, you know, and we can upgrade this. I mean, we can go to 4 on the bottom.
What's the next level? Okay, so next level up.
Next
you
level.
Got 2 implants, snap in, snap out.
We can go to 4 implants. We basically get off of the tissues and get onto more, you know, a 4 to 6 implant range where we're basically wearing teeth that are anchored solely by implants. Get them completely off of the tissues, and that's back to natural teeth.
And what could you eat? I mean, how soon can you eat after getting one of these scenarios that you're talking about?
A lot of these procedures, you know, it's going to be as soon as you're comfortable, and most people it's a couple days.
Couple days. How come I've seen on the internet? You know, I do a search because you say you do this all on 4 procedure, 4 implants, get a fixed set of teeth, and they're showing pictures of people, dentists across, that where you bite an apple after the procedure. I mean, that can happen, even though you don't recommend that.
That's a big statement to say, you know what? Here's somebody who's been without teeth. They've dealt with the challenges of a mobile set of teeth. The nutritional component, you know, when we talk about locking teeth into place, it opens a whole door of things that we can now eat. We're no longer in the boil the vegetables till they're so soft that you can chew them up.
They lose the fiber.
They lose the fiber, they lose some of the nutrition.
So can they eat broccoli? I mean, they could eat?
They can. In fact, the case that I just showed you, she talks about, you know, I used to go to restaurants. Denture wearers are notorious for having to dodge the salad. I mean, it's very difficult to chew on those lettuce leaves.
Is she like a spokesperson for you or something? I mean, she likes to tell
her story. Her story, it's so powerful, and she represents a large group of people.
Okay.
But she's she's so excited about it. She really is. She's a walking.
So when it's all done, what does she say to you? You were saying about the salad?
Yeah. Salads we're talking about, she said she used to have to pick out the little carrots or anything that had any difficulty chewing on, and that's a lot of the salad. I mean, most people skip the salad, and that's skipping a big nutritional component of the diet, and that's really too bad. And we're actually seeing, like I mentioned, years taken off people's lives because of nutrition.
And we are close to out of time, but let's mention something you guys do that is a little unique. And correct me if I'm wrong, that nationwide, the way it's normally done, you go to one person, the surgeon or the person that does the surgical procedure. You go to another place to get the imaging. Then you go to another place where they put the tooth on the implant. You do all of that part right there. Is that correct?
That's correct. All under one.
So that's not how it's normally done, though, nationwide. Okay,
no, I would say traditionally the average dental practice, you're not going to see implants available. The average dental practice, there's going to be a team approach where they have to go out to a surgeon, it has to be scanned somewhere else, and then ultimately ends up back in the dentist chair if they're comfortable.
Aside from convenience, though, why is your way with one person doing both procedures better? Is there?
Absolutely. We have the end in mind. We know where the case is going, so surgically implants are being placed for the restorative aspect, which is
tooth, you mean?
Where the tooth's going to go.
Okay.
Absolutely, we're gonna put the teeth or the implants where they need to be, so the teeth can.
So teeth in a day. I mean, if everything works out well, I mean, in a perfect world, denture we're watching this. They go, maybe they get some images, some models. One more visit, they have a set of teeth.
Yep.
Is that correct?
That's correct.
If everything goes right. And how soon? So somebody's watching this. They've been in dentures 20 years. Okay. If everything works out, how fast could they have a fixed set of teeth in their mouth?
I mean, you're talking about if they have an existing
2 weeks from
denture, they can be locked in one appointment. Now, some of these denture wearers, they may be ready for a cosmetic denture in addition to those implants, and that's going to take a couple weeks or a week. But
literally 2 weeks from today, okay, and this is a taped program, but 2 weeks from today, this denture wearer could have a fixed set of teeth in their mouth if everything goes right.
If everything goes right, absolutely.
Is that right? And does that happen, though? I mean, in 3 weeks? I mean, what's the reality of it?
Using your scenario, denture wearer comes in, we take the scan, we do a little consult, and literally 3 weeks later, we're locking their teeth into place. That's what's possible.
Eating and chewing and feeling good?
Eating and chewing and feeling good. Certainly, there is a integration period of time that we allow for implants before we put on the final prosthesis, but they're going to be locked into their denture in that window of time. Beyond that, we want to make sure that obviously we've had complete healing and integration.
And one of the things you said that when they were miking you up, you said, Randy, I love this part of dentistry. I love dental implants. Elaborate on that.
To me, Randy,
I mean, all areas of dentistry, you like that.
all areas of, I'm passionate about implants because I love the changes that I've been able to see in people's lives. It's so connected to me. It's that I'm not comfortable with my smile because it's mobile, because I don't like the way it looks, because I feel like I'm vulnerable, I'm susceptible when my teeth can move on me, to all of a sudden being locked in, confident. The change that happens, in their eyes, in their lives, it's really incredible. And I love being part of that. I love participating in that process and seeing, I saw the beginning and now I get to see the end. And as they literally skip out the door, with that type of a change.
Skipping out the door, okay.
Skipping out the door because it's that big of an impact on their life.
Tell me this, and we are out of time, but this all-on-4 procedure that you refer to, 4 implants giving somebody something fixed. I mean, isn't that what everybody wants? I mean, they want something fixed.
Absolutely. That's, as you see here, you've got, this is the teeth that they're going to get. They're screwed into place. People want teeth that aren't going to go anywhere. Some people don't mind the in-out, but some people, it's unacceptable to have anything that comes out of their mouth.
And these chew and feel like they're regular teeth.
Chew and feel like regular teeth. And it's a big deal for people to get back to, it's like turning back the clock and giving them something that they've forgotten how it was.
Yeah.
And now they get to feel it again. And it's incredible to watch the transformation.
Is this one of those things where they say, Dr. Homer, I wish I would have done this years ago, or I should have done it years ago?
One of the most common feedback points that we get is, if I would have known that it was painless, if I would have known what kind of changes it was going to be in my life, I would have done this a long time ago. And they're almost mad at themselves that they didn't.
Do you find out, people with dentures have friends with dentures, oftentimes, I guess. I mean, is that a big part of your practice, referrals, where they get it done and they go out there telling all their friends to do it?
I would say referrals are a huge part of our practice because, of the type of procedures that we offer and at the comfort level that we do. But most people are very secretive about wearing dentures.
Okay.
Some people know their parents are wearing them, or some people see that there's a partial denture or something with the clasps. But other than that, most people are I don't want anybody to know that I'm wearing anything. And that's really where implants support that message.
Okay.
Because now they're not coming out anymore. There's no, just in case, there's no turning down a dinner invitation because there's a limitation on that. But what if your gums are too bad?
What if somebody watching this, and I've talked to somebody, in recent times about this, that they say, they've been told their teeth have to go. Dentures or dental implants. And they told me their gums are too bad. What is your response to that? Can that happen?
Gum tissue is the nature of periodontal disease.
Okay.
And when we clear up the reason that the gum tissue is bad, and that usually has to do with the teeth that are in place, that all cleans up. And
so the gums get better.
And it's absolutely, and it's what's underneath. And with implant, we're talking about bone.
The gums get better?
Absolutely. The tooth is the source of a buildup of plaque and debris, and that's what gets the tissue upset. We take care of the problem, all that goes away. And it's amazing how they feel about things. I mean, the infection is gone, the pain is gone, they're smiling, and that's the big deal message
do they send you cards ever, or thank yous handwritten?
Real often. That's one of the
because you don't get that with a root canal, right? or a bridge or a partial.
Periodically getting someone out of pain, it's a big deal.
Okay.
But probably, those are the ones where you get people coming in and dropping off cookies. This lady, Robin, she actually brings in salsa for me. She brings in dozens of cookies for our team.
That's nice.
Because they're so grateful that there was somewhere that they could go. They could get the work done that they wanted. They can be sedated and not remember a thing about it if they want, and then snap in their teeth and eat whatever they want. It's really
okay. So and we're out of time. Let's give a recap. Okay, so denture wearers could get a fixed set of teeth in just a few appointments. 70-year-olds, 80-year-olds are doing this, and this company philosophy of guaranteed same day appointment.
We're gonna, and especially when you're talking about someone who, I talked about earlier, the broken tooth, the inconvenient, I'm in pain, I need to see somebody today. Absolutely.
And IV sedation, that means they can go there comfortably And they think it's 5 minutes, and
they wake up and they're done. And
Okay,
that's not something you're going to find everywhere. We've got all the different levels of sedation,
okay.
and I'll tell you, Randy, it's a big deal.
So what's the first move? Final message. Denture wearer watching this. What do you do? Invite them in?
Yeah, come on in. Let's sit down in a very low stress environment. Talk about what your concerns are. Talk about where we'd like to go. And the big
Okay.
thing is my job is to educate. I'm going to tell people this is what we can do for you. And there's always going to be multiple choices. And then we're going to find the one that's best for your budget, that's best for your circumstances, and that's best for the bone that's available. But it's really that simple. Let's get them in the door. Let's get to know them, understand their needs. Do we need to be sedated? You know, which direction are we heading? And then at the end of the day, we're all leaving with smiles because we know where we're headed and what the potential
Dr.
outcomes
Brewer
can be.
says this, and I hate to say that I don't believe it, but it's hard to believe. He says sometimes the doctors in your office are walking by each other and say, "We have the best job in the world," in the hallways. Have you ever seen that happen?
Yeah, you know, there is a great satisfaction in getting people out of pain and offering solutions to some of these denture problems have been around for a long time. And there haven't always been solutions, but there is now, Randy. And that's the message that hopefully we get out to some people about their choices that are out there for implants and stability of dentures.
Thank you for coming on the show. Very good.
Randy, appreciate your time.
Good
Thanks
stuff.
for
So they
having
can
me.
visit your website, find out more. You're watching the Wellness Hour, leader in medical news and information. No more dentures. Get a fixed set of teeth in just a few appointments. You could call and ask for Dr. Homer. This interview will be on our website at wellnesshour.com. Just put in Dr. Homer or dental implants, Montana. For now, I wish you good health.